Hi everyone, and welcome back to Nurses Move, the channel dedicated to the nurses who want to move abroad. I am Dina, I am an expat nurse, I'm Italian and I live in UK since 2015. Today for our interview from the world, we are with Nichole McIntosh, and I'm very happy and glad she's here with us today. Thank you very much, Nichole.
Hi, Dina. Thank you for having me.
Thank you very much for coming. I'm very happy to have you here. So for just an introduction of Nichole, she's many things actually. So I'm very happy she spent the time with us today. She's regional head of nursing and midwifery for the Health Education England in London. She is the editorial advice, nursing management journal and poet. She is director and consultant on Maroon Mindset Unlimited. She's a digital broadcaster with YouTube and with the blog Human Touch. She had a title FRSA, which is a fellowship received by the Royal Society of Art for having made outstanding achievements of social progress and development.
Thank you.
So thank you very much, Nico, to be with us today. You're very inspirational for us. And you are inspirational not just because you made so many things, and because you're an expat nurse and you were able to achieve all this beautiful and amazing work you've done, but because even if you are on a high level, you're still very compassionate and human, and you're so kind that you always helpful. And yes, I can see you from LinkedIn, the work you do, you always willing to help. So, and this is the demonstration you are with us that you're very happy to help. So thank you very much.
Thank you very much, Dina. I think it's really important that as leaders, it doesn't matter what your job title is, that you hold on to the values that brought you to the profession. So being kind and supportive of others is really important for me.
Thank you very much, sister. So I've got a few questions for you today. Thank you very much. Just the first one, can you introduce yourself and tell us where you come from, why you choose to be a nurse, and when? Thank you very much.
Okay, so I'm Nichole. I am the mother of two. I'm married. I'm a nurse of over 21 years in the National Health Service. So I became a nurse because I have always been a kind, caring person. So that's what brought me to the profession. It fits my values of doing something good in the world, to help a patient and their family when they're in their most vulnerable state is really gives me a sense of satisfaction. So I'm a proud, passionate, kind nurse, and I have been blessed and I'm really fortunate in my career to be surrounded by people who believed in me and who pushed me along the way to achieve as much as I could. And to remember that it doesn't matter what your background is, there is still hope and there is potential. The career that I chose as a nurse has a lot of opportunities. So it's really been a wonderful journey. It hasn't always been positive, but I've tried my best to always be better and not bitter. So I use my journey as inspiration for others who are coming up after me to inspire them to do even greater. So to go even further and achieve even more.
Yes, it's nice and wonderful. Yes. So, where you come from?
I'm from Jamaica. So I came here in 1996. So many years ago, I came here, and it was a culture shock to come to the UK. Everything's different. I came in the summer, but still it was cold for me. I felt really cold, and people are saying, you haven't seen anything yet, wait until winter. So it's taken a while. It took a while for me to kind of get used to a different culture, different way of being, different ways of talking. And so I started my nurse training a year later in 1997 in London. Okay. And I qualified in the year 2000. So yes, I'm a Jamaican. So I bring my Jamaicanness with me in terms of my approach to life and trying to be more measured and not as uptight and tense. It's more a relaxed way of living.
Yeah, absolutely. I believe the multicultural is what is, if we bring together, can give a big push in growing in our nursing care. It's a piece of everything, yes, and we can use for grow ourselves and our
Agreed.
profession. Absolutely, yeah, agree with you. So can you just explain your career path in terms that we can learn from you and understand what you do if you want follow our dream? Because moving abroad as a nurse is not easy. And sometimes we move abroad because we need money, because there are pushing situation that really push us to move abroad. So, and people just don't really care about career, or just don't thinking about, because they really need to move abroad for live,
Yeah.
actually, for have a life. But yes, there is a lot of opportunity, especially now in UK. There are very much opportunity. So if you can explain your career so we can understand how to do, please. Thank you very
Okay,
much.
so everybody's journey is slightly different, and it's important for us to accept where we are and not to be too hard on ourselves in terms of our circumstances that we find ourselves in. But maybe always thinking about, where would I like to be in a year, 5 years, 10 years time? It's always good to have something to work towards. So for me, I started out on a acute ward. After I qualified in the year 2000, I started out at the Royal London in Whitechapel,
Oh,
and
okay.
I worked on a medical ward. And it's important for you to kind of gain confidence when you're transitioning from being a student to being a registered nurse. And to do that at a big, teaching hospital was really
Yeah.
good, because I was exposed to different nurse specialists, and then I saw the opportunities that others who were more senior to me could kind of spend some time with the tissue viability nurse or the diabetes nurse. And it kind of opened your mind to thinking what exactly you think you would like to do in the future. It's not good to specialize too quickly. So I would say, don't specialize too quickly. Be exposed to medical, surgical, ITU, whatever you feel that you're passionate and you want to know more about. Get some exposure. So I did that for a number of years, and then I worked in hematology. So when the opportunities, I was always kind of keeping abreast of what jobs are on the market, even if I wasn't looking for a job. It's
Okay.
nice to know
Yeah.
what roles are very, popular. You keep seeing a role. After a while, you're kind of thinking, I've seen that advert before. I wonder, let me look at the job description. There's no harm in looking, even if you're
No,
not
absolutely.
looking
Yes.
for a job. Because sometimes you might see an opportunity and you think, I want to know more, and you call them up, and you realize that while you might not have been thinking about finding a new job, this is an opportunity that you shouldn't miss. So I
Yes.
think it's just being ready for opportunities. And I've always done that in my career. Whenever an opportunity comes up for me to push myself to learn something, I've always kind of gone for it. Even if I'm a bit nervous and I'm not sure, I think it's best for me to go and learn more. And you won't, there are certain things you'll hear and you think, oh gosh, I don't think I could work in that environment. Like for me, A&E, I wouldn't be able to cope with that fast-paced adrenaline rush all the time. I am someone who's an introvert, so I need to work in an environment where I can have some time to process what's
Okay.
going on. So for me, A&E wasn't an option, but I did enjoy my placement as a student in A&E. It gave me enough experience about resuscitation. So yeah, I think I then became a nurse specialist. I went to work in hematology, and then I did some research, and then I became a nurse specialist at St. Bartholomew's Hospital. And I was dealing with primary immunology, where we went to the PCTs, the primary care trust. They were called CCGs now. And we got funding so people could enter the home therapy program. And while I was doing that, I was advocating for patients, and I quite liked that. I was a patient's voice. So as a nurse, we are the people, the patient's advocate. And that really helped me to kind of see these patients who might otherwise have had to change their life, but they were able to live a fulfilling life while getting their medication at home. That was good, because it made me realize the impact that I could have. you know, to help patients and their families. And then I became a ward manager, you know, and then I became a matron. So as I said, when opportunities come up, and sometimes you sell yourself a bit short and you think, I'm not ready. But sometimes you have to push yourself.
Yeah.
And to be uncomfortable for a while, it's like that novice to expert kind of thing from Benham, where we're thinking, oh yeah, I'm an expert, so I'm quite comfortable. But if you get too comfortable, you lose confidence in terms of applying for jobs. So you want to always kind of be thinking, what is my next step? Where do I see myself? So that's what I've done. And I've applied for roles sometimes and didn't get it. But I just look at it that was just not meant to be. If it's not meant to be, I learned to move on. And I take the lessons from maybe the experience of interviewing at that level, but not to beat myself up and I worry too much about what's past. It's kind of drawing a line and always focus on the forward.
Yeah, absolutely agree with you. I just have an interview for clinical research nurse, but I never had experience. And the interview went well, actually, but all the candidates were more stronger than me. So it's fine because I just was the first one I had. For me, when I was an experience and I learned a lot. So, of course, never think as a failure, but just think as, okay, a growth in terms of experience. Absolutely agree with you. Thank you very much for sharing. So, you are regional head of nursing midwifery, health education in England. So you really focus on education and inspiring young generation as well. What is your dream in nursing improvement and nursing growth? And what you believe in regarding?
Yeah,
Thank you.
For me, it's important for us to always have nursing as a career option for young people. You know, we really want young people who are making decisions at school, at colleges, about what they want to do with their life to be attracted to a nursing or midwifery career. So we want to make sure that the leaders that we have are inspirational, so that when they speak to young people, they're able to not sugarcoat what the journey is, but to show them how much satisfaction and lifelong learning they can get from having a career. So for me, it's really to ensure that we pay nurses well, that we look after our nurses, that we educate them, and we develop them, and we attract the people with the right values. So that's where my dream is, to ensure that we have people coming into nursing for the right reason, because they're kind and compassionate, not because, oh yeah, I think I need a job, so nursing will do. That's not good, because it's a tough career. It's not easy. So if you're coming into it for the wrong reasons, you won't last. And we don't want to set people up to fail. We want people to thrive and flourish. Exactly. So yes, my dream is to see nursing as a career where we have a sustainable workforce, where the nurses we have feel empowered and valued, and they want to do a good job, and they're inspiring the next generation. So we keep it going so that our patients will always have high quality care.
Yeah, I can see you very care about well-being of nursing, of nurses. Sorry, because yes, a part of you speaking a lot about equality, diversity, and inclusion, but also with your YouTube channel and your blog, you're really in about well-being. Actually, how can nurses can feel healthy and can be inspired and can then pivot their person and their career. So yes,
really important. It's really important for us to look after each other, because we are the carers, but the carers need care too. So we need to be able to say, actually, I'm not feeling okay. And that's okay for me to say, because nobody's going to judge me. They're going to support me. So we need to get to a space where we look after each other, and we pick up signs when someone's not being themselves, and to offer some support and a word of encouragement, and taking the time to listen. And mental health and disclosure of mental health issues is really important for us as nurses to embrace.
Yeah, so especially for what's happened the last couple of years. Yes, and we lose a lot of valuable nurses because of the hard situation. And yes, it's not just in UK, it's all around the world. The government just push us as a nurse because we actually are capable to do extraordinary things, so just pushing us. But yes, so I think if the other people, not because they don't care about us, but because they really don't realize our job. So that they cannot understand, but we know. So yes, we have to take care of ourselves, each other. Yes.
Agree, definitely.
Thank you very much. So I have a last question for you. You know, lots of international nurses can't really move abroad because they have to do tests. They are very important, of course, but are tests that are very expensive, or for example, the test center is very far away from their place they're living, so it's very hard for some nurses to really be able to do this step for to move abroad. But there is another way to do this, and this is a scholarship that some country can offer to those nurses. For example, a scholarship for international student for master degrees. So for have, you know, a growth in a skills and career. So those nurses, after done the scholarship, they actually able to apply and register on NMC and be able to do their career abroad without those tests that are very hard to manage at home. As a head of regional health of education for nurses and midwives, what do you think about? Do you think this is an easy thing to do? Do you think there is any opportunity? What do you think about? Do you think this is a good idea to move abroad?
Well, you know, as an immigrant, a first generation immigrant, I think everyone has to make the decision for themselves about opportunity. And if you're in your country and you're struggling with opportunity, you know, we can't say don't apply. I think it would be wrong of us to say don't. Well, I think you just have to be aware of the dangers and you know, the risks in terms of it, as you say, it's expensive. So it's maybe having a plan. I think ethical international recruitment is okay. So where you're not robbing, you know, the brain drain that we talk about, where we as a UK rob other countries of their professionals. We need to be mindful of that. So that program of work is being really well run by NHS England. So they have a whole international recruitment team. But I would say yes. I would say if there is an opportunity for you to come over and to receive some kind of funding. I'm not aware of the scholarships that you mentioned, but I think it would be worth them looking at Florence Nightingale, you know,
well, there is a many in the different universities, not just for nurses. It's just it's a scholarship for international students. So there is a different courses in a different universities. Universities. The only thing is they're very few. So I mean, there's of course there's not enough for them. The many demand. This is the point.
But I think it's definitely worth advertising through your medium here about where people who are maybe watching this could go and get some more information, because as you say, it's not many, but it would be a shame for the ones that are there not to be used. So yes, I think we encourage people moving around the world because we're a global nursing village. And we need to be able to care for people from different backgrounds. And when you work with people from diverse backgrounds, it makes you more tolerant, you're more open-minded, you're more of a world traveler. So even if you do go abroad from the UK, you've already been exposed to certain cultures, and that is a good thing.
Exactly.
In a world where we're trying to be tolerant and to show that there is more that unites us than divides us. I can see international recruitment playing a key role there. So I would welcome people to look into it, but maybe just having a plan that if it doesn't work out one way, having a different options would be advisable.
Exactly. It was, I always repeat, having a plan is good because you save money, of course, but you save in time as well. And this is important because if you save in time and you do the right thing on the right step, you arrive in the place you want to live and work in soon. So you don't lose any time. You can start your career. You can start enjoying life. You can start enjoying a new way of nursing because, yes,
Agreed. Agreed.
Oh, Sister Nichole, I'm very, very glad you spent this time with us today. It was very inspirational, and I don't have word to say thank you enough. Honestly, yes.
Thank you very much. I think what you're doing is quite inspirational as well,
Oh,
because
thank
you
you.
are the face of what a nursing career can do in terms of building your confidence to be hosting a platform like this and to allow us as leaders to come and speak to you. So I think it will inspire others who have similar aspirations. So well done.
Oh, thank you very much. Yes, it's not easy at all. I'm a mom of three. I've got endometriosis, so it's kind of tough
Well done.
sometimes. But yes, because I've been there path 6 years ago, so I know what's mean.
Exactly.
Thank you very much. I'm very happy. I hope we can still in touch on LinkedIn as well. I follow you still. So
definitely. Well done. Thank you very much for having me.
Thank you very much.
To be here.
Thank you very much, Nichole. Have a great day.
You too.
Thank you.